Good morning. On Friday, we all breathed a sigh of relief when the second round of testing for residents, staff, and visitors to Whisperwood Villa came back negative. But today is not such a happy day, and I have difficult news to share with you. We have 2 new cases of COVID-19 in P.E.I. One case was announced yesterday in a news release, and 1 additional case was confirmed last evening. So we now have 8 active cases of COVID-19 in Prince Edward Island for a total of 35 cases since the pandemic began. All 8 individuals who currently have COVID-19 are doing well and are self-isolating at home. There's no one in hospital. The 2 new cases do not appear to be linked to the cluster of cases reported last week, and these cases are not connected to Whisperwood Villa. The 2 cases are also not related to seasonal residents or to travel within the Atlantic bubble. The case confirmed yesterday, just before 11 o'clock, is a woman from Queens County in her 80s who lives alone in her own home. She has been diligent in keeping her circle of contacts small, physical distancing, and wearing a mask when in public. She went to the QEH emergency department by ambulance on Saturday, July the 4th, and was there for 6 hours before being discharged home. As she was not displaying any symptoms related to COVID-19, she was not tested for COVID-19. Because she went to hospital by ambulance, she had no contact with anyone in the QEH waiting room. Also, she was in a private room. She underwent diagnostic tests while at the hospital, and she was transported home by family members in a personal vehicle. She has been in self-isolation at her home since July 4th. And on Saturday, July 11th, when her symptoms worsened, she called 811 and was tested. The test was confirmed as positive and was reported yesterday. And when we received the confirmed positive test results and reviewed the patient history, our immediate priorities were to conduct contact tracing and identify and test all the QEH staff members, including Island EMS, nurses, physicians, and diagnostic imaging staff who were in contact with the female patient while she was being cared for at the emergency department on July the 4th. So we identified and tested her close contacts as well, and a total of 47 tests were completed yesterday in relation to this case. And unfortunately, a healthcare worker, a man in his 40s, tested positive for COVID-19. This individual works in the emergency department at the Queen Elizabeth Hospital and had been outside the Atlantic bubble recently, but within Canada. And essential healthcare workers who travel or arrive from elsewhere in Canada have been able to work as long as they are tested immediately prior to reporting to work and wear appropriate PPE. In these situations, healthcare workers are required to work isolate, meaning they are able to go to work and go home immediately following their shift. This protocol for essential healthcare workers is consistent with practice in other provinces. This healthcare worker arrived here in the province on July the 2nd and was tested. And in accordance with current provincial guidelines, he was able to return to work on July 4th based on a negative result. He wore appropriate personal protective equipment and followed all hospital procedures when caring for patients. He had contact with our positive COVID-19 case while she was a patient at the QEH emergency department on July the 4th. The healthcare worker COVID-19 test results were confirmed last evening around 7 o'clock, and our office, in collaboration with Health P.E.I. and the Queen Elizabeth Hospital, have done a number of, initiated a number of things since that time. Firstly, we have prioritized contacting and testing all the patients and staff who had contact with the COVID-19 positive healthcare worker. We know he worked 7 shifts at the QEH emergency department between July 4th and 11th, and we are able to identify all the patients he cared for. All patients and staff he's had contact with between July 4th and July 11th will be tested. Some may require 2 tests. All patients and staff are being contacted by phone to arrange for testing, And these calls started last evening and then again this morning, and testing is underway. Approximately 100 patients and 125 staff have been identified as contacts of the positive healthcare worker. As well, visitation at QEH will be effective immediately until we have more information about the test results. So no visitors will be allowed to the hospital with the exception of the following nursing units: labor and delivery, pediatrics, and intensive care. And these 3 nursing units are limiting visitors to only 2 people, and visitors must call ahead before going to the hospital. Of course, exceptions may be made for compassionate reasons, but please call ahead. As well, there will be an enhanced personal protective equipment for all QEH staff. The electronic medical record system at the hospital makes it easier to identify patients cared for by COVID-19 and a COVID-19 positive healthcare worker, including the date and the time they were in contact. And I have confidence in the ability of this system to identify all the patients cared for by this individual. And I encourage everyone who's been at the QEH Emergency Department between July 4th and July 11th to continue to be patient and calm. Not everyone who went to the QEH Emergency Department during this time frame will need to be tested. All individuals who have been in contact with the COVID-19 positive healthcare worker will be contacted to arrange testing. Health system staff are committed to completing the testing as quickly as possible. Arrangements will be made to accommodate individuals who are unable to travel to the testing clinic. And individuals will be contacted by phone with their test results. In addition to work-related contacts, 3 close personal contacts of this individual will be tested and required to self-isolate for 14 days, and they will be followed by public health. Anyone who has symptoms related to COVID-19, who was on the WestJet flight 654 from Toronto to Charlottetown on Thursday, July the 2nd, should also call 811 or their family doctor to arrange for testing. We cannot be definite about exactly how COVID-19 has spread in this situation, but there certainly is a link between these 2 cases. This is a challenging and worrisome situation. The increased number of contacts, both patients and staff, makes for a larger and more complex response. But we are ready to respond to this challenge, and I'm confident in the ability of our health system to manage this outbreak. Our top priority continues to be limiting the spread of COVID-19 and ensuring the safety of all islanders. And this includes our frontline healthcare workers. We will be working very hard over the next 24 to 48 hours to complete contact tracing and testing in an effort to contain further spread of COVID-19. The results of contact tracing and testing will be critically important in limiting the scope of this outbreak. I speak for all islanders when I say I hope the spread of COVID-19 to QEH patients and staff has been limited. We will all know more about the extent of this outbreak within the next 48 hours. Our healthcare system continues to be well equipped and ready to provide quality care to islanders. Emergency departments across the province, including the QEH, remain fully operational. And if you have a medical condition that requires immediate attention, please do go to the nearest emergency department. We have an adequate supply of PPE for all staff. Staff at the QEH will take additional safety precautions with face shields, gloves, gowns, for instance, until all test results are received and the scope of this outbreak is known. In addition, effective immediately, our office will be reviewing the testing requirements for any essential healthcare workers who travel outside the Atlantic bubble. I know some of you are wondering about what these new cases mean for travel under the Atlantic bubble. We're into our 2nd week of the Atlantic bubble, and it is going well. And none of our 8 active cases are related to travel within the bubble. But this situation raises questions about the possibility of the Canadian bubble. Although ultimately this is not my decision, I believe it would be premature today to be considering a further loosening of our border restrictions and encouraging broader travel. And certainly that will be reconsidered as we go forward, but not today. As a province, we've worked hard to prevent the spread of COVID-19 in our community. We've done screening at our points of entry. We have limited the size of organized and personal gatherings. We've developed isolation and testing policies for temporary foreign workers. We've recommended that people wear masks in indoor closed settings. We have contacted people in self-isolation every day, and the list goes on. And these measures have helped us manage COVID-19. Certainly, while having 8 new cases in just over a week is concerning, upsetting, this most recent outbreak does not necessarily mean that we will see widespread transmission of COVID-19 in our province. But with 8 cases in the province, we know that COVID-19 is circulating. And I've been saying for weeks that it has not gone away and that we must remain vigilant. And I still feel at this point we have been fortunate to date not to have any hospitalizations or deaths related to COVID-19. But the rate of increase of cases in the last few days is a clear message that individually and collectively we need to be more aware of how our behaviors affect ourselves and others. We all need to be concerned for our own health and safety as well as the health and safety of all islanders. Now more than ever, I am pleading with islanders and visitors to our province to pay attention to public health measures. I am recommending measures that are known to be effective in limiting the spread of COVID-19. Our hand washing, our physical distancing, keeping our circle of contacts small are effective. And I'm also appealing to and expecting islanders to wear face masks or coverings when in closed indoor spaces and where physical distancing is not possible. Your mask may protect others, and so please let others know that you care about their health and safety. And the more people that wear a mask, the harder it is for the virus to spread. In closing, I want to acknowledge that this is a very difficult time for our frontline healthcare workers. They come to work each day to provide care and comfort to islanders, and today they need our support. It's also difficult for all islanders. We've all worked so hard, and we put so many measures in place to keep us all safe and to protect ourselves. So today I ask all islanders to be patient, to be kind, and to be understanding. Thank you. And it'll open it up for questions for the Premier and I.
Bonjour, Dr Morrison. Pouvez-vous exactement clarifier la situation tout d'abord en français concernant donc cette dame âgée dans les 80 ans et surtout cet homme dans la quarantaine qui est donc un travailleur essentiel. Est-ce que vous pouvez traduire un petit peu tout ça en français, s'il vous plaît?
OK, je vais essayer. On a eu des résultats hier qu'une dame dans ses 80 était testée positive pour COVID-19. Et quand on a parlé, elle a indiqué qu'elle était à l'urgence à l'hôpital le 4 juillet. Alors, on a commencé à faire les contacts et tester tout le monde qui était à l'hôpital 7 jours, qui a eu un contact avec cette dame. Et en faisant les tests, il y avait plus de 40 tests qu'on a fait hier qui ont eu un peu de contact avec cette dame. Et puis, une des résultats était positive à propos d'une personne qui travaille à l'urgence. Alors, on a eu ce résultat hier soir et puis après ça, on a commencé à contacter les autres membres qui travaillent à l'urgence, qui ont travaillé avec cet homme et aussi des patients avec qui il a eu du contact entre le 4 juillet et le 11 juillet.
Et Dr Morrison, est-ce qu'on doit s'inquiéter de voir une propagation de la COVID-19 à l'hôpital Queen Elizabeth Charlottetown après la découverte donc de ce cas pour ce travailleur essentiel? Est-ce que vous avez peur de voir beaucoup de cas de la COVID-19 arriver à l'hôpital Queen Elizabeth?
Oui, je suis inquiète. Il y a quelqu'un qui a fait... on sait qu'il y a maintenant un link entre les deux cas à l'hôpital et ça m'inquiète qu'on peut voir d'autres. Et puis, ça me fait la peine d'en penser.
Brian Higgins, CBC.
Dr. Morrison, can you tell us more about that emergency health care worker? I've just had a bit of trouble following your description. Like, did the woman in Radies give the COVID to him? Did he give it to her? And what was he doing? I mean, I didn't quite follow all the details about his travel. And what is he, a doctor or a nurse? Things like that.
So he's a healthcare worker who works at the emergency department at Queen Elizabeth Hospital. It is not clear if it was patient to physician or physician to patient, or sorry, healthcare worker to healthcare worker. Because it could be a nurse, it could be a physician, it could be someone who looked after the patient. But if it's hard to know. We have 2 positive cases between a healthcare worker and a patient. We don't know exactly how that is transmitted. But we think it's really important to continue to test anyone that healthcare worker may have had exposure to, and so we may learn more. Is that helpful, Brian?
Yes, yeah, and also just the nature of his travel. He had been outside the Atlantic bubble and came back in. Is that correct?
Yes, that is correct.
And he's sort of an island healthcare. He's an island healthcare worker as opposed to someone from away coming here to work.
This healthcare worker is currently working in Prince Edward Island.
And is this now community spread we're dealing with the implications that might entail?
Well, I think we won't know all the details for the next couple of days. I think that is obviously a potential concern, and whether it is linked to travel outside the bubble or more community transmission. It's not exactly clear at this point in time, and that's why the extensive testing today will be really important.
Radio Canada.
Good afternoon. Bonjour, Dr. Morrison. J'aimerais peut-être que vous m'expliquiez aussi en français le lien qui existe entre la dame qui est âgée de plus de 80 ans et le travailleur de la santé. Donc, qui a transmis le virus à qui dans cette affaire-là?
Même réponse qu'en anglais, on ne sait pas pour certaines. On sait qu'il y a un lien entre le travailleur et puis la dame, et on va voir si on a d'autres cas. On sait que les contacts avec la dame, ces contacts étaient négatifs. Hors de la personne à l'hôpital, mais on va voir dans les prochains jours. Mais ça m'inquiète.
Dans les 2 cas, vous êtes en train de tester les contacts de ces 2 personnes. Où est-ce que vous en êtes avec les tests? Est-ce que vous avez terminé les tests pour la dame de 80 et pour ce qui est du travailleur de la santé? Quand pensez-vous être en mesure de compléter au moins une première ronde de tests?
Alors, on a complété tous les tests pour la dame, le premier cas, et puis à part la personne à l'hôpital, c'était tout négatif. Et on espère avoir la majorité du staff et des patients testés aujourd'hui pour la première fois. Alors, j'imagine que les résultats plus tard ce soir ou demain matin.
Merci.
Karine Fleury, La Voix acadienne.
Oui, bonjour, Dr. Morrison. J'avais une question en français. Est-ce que vous pouvez me répéter ce que ces nouveaux cas veulent dire pour la bulle atlantique? Est-ce qu'on doit s'inquiéter?
Je sais qu'on est en train de discuter la boule canadienne et je sais le premier ministre ici, M. King, peut en parler aussi, mais à cause du voyage hors du province, des cas, hors du boule atlantique, aujourd'hui, ce ne serait pas quelque chose que j'aimerais annoncer pour certains. Alors, on va encore discuter, mais c'est pas une décision pour la boule canadienne pour aujourd'hui.
Parfait, merci.
Alison Jenkins, The Guardian.
Yes, good morning. I'm wondering if the woman presented at Emerge for symptoms related to COVID, or was it another concern?
I believe I stated that it was the symptoms were not consistent with the classic COVID-19 symptoms, so she was not tested. And
Right, okay.
Yeah.
Okay, so then my next question is about masks and PPE. We've been getting some comments, and you said today that there's been increased personal protective equipment like requirements in place at the hospital. Is that all across health P.E.I. facilities?
The enhanced personal protective equipment would be in particular for the QEH, but I know the QEH issued guidance last week. I think there was an updated guidance about mask use throughout health PEI. And so both things are underway. There's a guidance about masking throughout the system, but also as of last night and today at the QEH, it would be particular enhanced personal protective equipment.
Okay. And so,
Alison, we're just going to, we're going to add.
Just let her ask the question. Go ahead.
Masks and wondering if it's going to become mandatory.
For masks in the community, so
Yes.
So, I mean, we just talked last week about the strong recommendation we have, and I think I mentioned today it would be an expectation that masks be worn if you're in an indoor space and cannot maintain physical distancing. And the reason, certainly, that making masks mandatory, it is challenging. There are some individuals who do not, who are not unable to wear a mask for medical reasons. Certainly small children are unable to wear a mask. And so we talked about it last week as well, that at some point it may need to become mandatory, but it is our strong recommendation, and it is my expectation that that would happen.
Thank you very much.
Okay, you're welcome.
Carrie Campbell, CBC.
Thanks. Good morning, Dr. Morrison. You expressed some concern about what might be happening with this outbreak, perhaps as maybe our first case of community spread. I just wonder if you could speak to what implications this may have in terms of, our current stage of opening on PEI, of conducting business, as well as the Atlantic bubble.
Hi, Carrie. And I think I said in French, I think we have had a number of situations in the last week or so that have caused a great concern, and this one really seems to impact me in a different way, because my concern is for is it community spread, but also the link in the healthcare setting with the direct patient care. So it is a significant, I think I said in French, it you know, gives me pain to talk about this particular situation and what this could mean. And so absolutely, we will need to look at if there's evidence in the days ahead of broader community transmission, or if there is evidence of more spread. The questions around restrictions, the questions around travel, those will have to be looked at. But I think we need to wait for some more information to come through. At this point in time, we have 2 cases that are linked in a healthcare setting, and we need to do more testing. We've already started. We did a lot yesterday. We need to do a lot today. And remind Islanders that we have to look after each other and try to be as safe as possible.
Okay, and a follow-up to that then, and I wonder if I could hear from the Premier as well on this, but I wonder, I mean, what are the what is the pathway out of this, and what does it look like? You know, how many cases would you need to see before we might see a scaling back of any of the sort of openness measures we have in place now?
Well, thanks, Kerry. As Dr. Morrison has said, it's not so much a hard and fast number. It's just more of the impact and our ability to be able to identify, contain it, and work within our system. So I think, as Dr. Morrison has indicated here, and we have chatted for much of the last 24 hours or so, that we will let the next 24 to 48 hours, we'll let the testing take place, and as we have said from the very beginning, we will follow the evidence, and if the evidence suggests that in the interest and safety of Islanders, we need to begin to scale back, whether it's travel, whether it's any other aspects of our Renew P.E.I. plan, we will let the evidence do that. But I think the next 24 to 48 hours are important and will guide us going forward.
Thank you.
Thank you.
We'll now open it up to additional questions. Juliana Cachard.
Hi, it's Carrie Wynn for Motion 100.
Hi.
Sure, Carrie Wynn, go ahead.
Hi, Dr. Morrison. I'm just wondering, just for some clarification, when the healthcare worker returned, he returned on July 2nd, and he was tested then and tested negative. And then when he was retested again yesterday, had he been exhibiting symptoms, or was that just the testing to follow up because he was a healthcare worker?
So he was not exhibiting any symptoms that he would identify as COVID-19 symptoms. He was tested yesterday as a result of having, as part of the contact tracing of our initial case identified yesterday morning. And so that's, there were approximately 40 staff in diagnostic imaging. We mentioned EMS, nursing, physicians. And so, and one of those healthcare workers' tests came back positive. And that's what prompted the second test.
Okay, and just another question, just some clarification at Queen Elizabeth Hospital now. As you said, last week they had been implementing where all the staff had been wearing masks and then enhanced PPE today. What does that consist of, the enhanced PPE?
So, Carrie, in certain circumstances, it might mean making sure that in addition to masks, there's gowns, there might be goggles or face shields, one or the other. It would be making sure that not only masks, but maybe gloves and gowns are worn in addition. And so it would may depend on the setting and what you may be in the hospital for, but that is until we get some more test results back.
Great, thank you.
You're welcome.
Thank you.
So again, we'll open it up to additional questions. Brian Higgins.
All right, yeah.
Dr. Morrison, are the staff who were in the ER who are now being tested, was it 125, are they self-isolating in some way, or are they still working at the ER? And what kind of staffing resources, what kind of pressures is that putting on staffing of the ER?
Well, I definitely think there'll be some staffing pressures. But we've already been able to test, as I mentioned, 40 staff related to the first case yesterday, and overnight an additional 50 staff were tested, and their results are back this morning, and then an additional staff will be done today. So. Certainly, the enhanced personal protective equipment will be worn if there's any staff that might be at work. But any symptoms, of course, they shouldn't be working at all, and that has been already in place. But they are a priority because we want to make sure that they're tested quickly so they can continue to provide care for Islanders.
Thank you.
You're welcome.
I have a question for Premier King on a slightly different topic. La Presse newspaper is reporting today that a traveler to the Île de la Madeleine from Quebec was fined over $1,000 by the RCMP in Surrey as he stopped at the Tim Hortons to grab a coffee and went inside the shop. I'm wondering, do you feel that it's fair to ask travelers, fellow Canadians, to travel over 16 hours of driving without a stop, and then charge them the way that this gentleman was charged?
Well, thank you, Francois. I'm not familiar with the details of this case other than what you just described to me, so I'm not able to really comment on that beyond. I think what Dr. Morrison and I have been saying for numerous weeks now, of those who are traveling through New Brunswick and P.E.I. to get to the Magdalene Islands, we have been providing that opportunity for them to do so, much as other provinces have provided Islanders with the chance to drive through to get to their destination as well. We've asked all travelers to be mindful if they have to make stops for gas or to eat or to use the washroom, that they certainly would be permitted to do that, but to be cautious and to do everything they can to limit their interactions. So we've been advising that from the very beginning. But in terms of this particular case, I don't know. Neither Dr. Morrison and I are familiar with the details of that, but we'll certainly look into it. I think that it's important for all of us to remember that we are all Canadians, and there's a certain amount of humanity we need to show each other. And I'm certainly grateful to New Brunswick, to Nova Scotia, to Quebec, to Ontario, all of those jurisdictions who allowed Islanders to get back home when they needed to get back home. And I don't think it's too much for us to afford the same respect to our friends from Quebec.
A follow-up question, if I may, Premier. Sure. Knowing what we know today with the new cases that are announced, is there any plan to scale back on that road link that was provided to the Magdalene Islands travelers? Yeah,
I think what we've been saying here is that we have two new cases that appear to be linked. They're not connected to Atlantic travel, and they're certainly not connected to Quebec residents traveling through P.E.I. to get to the Magdalene Islands. So what we're trying to just do is to allow our dedicated and talented healthcare professionals and experts to do their work. We will follow the evidence as it's presented, and we will do essentially what we've been trying to do from the very beginning, and that is to be as forthright and honest as we can with everyone, and allow the evidence to dictate and guide our decisions. So until such time as we see what the next results present, we aren't prepared to do much different here right now, but we have remained quite open with the fact that if we need to scale back, whether it's travel, whether it's other aspects of our Renew P.E.I. plan, if the evidence suggests and Dr. Morrison advises, then we will do that.
Thank you.
Thank you.
Karine Fleury.
Aucune question, merci.
Merci. Julien Lecacheur.
Docteur Morrison, vous l'avez dit et le Premier ministre l'a dit aussi, les prochaines 24 à 48 heures vont être déterminantes pour savoir s'il va y avoir plus de cas, une transmission communautaire. Concrètement, Docteur Morrison, est-ce que vous êtes prête avec un plan pour revenir en arrière s'il y a une transmission communautaire, revenir à la phase 3, reconfiner? Est-ce que tout est prêt de votre côté? Est-ce que la possibilité est là?
Bonjour Laurent, ou Julien, je m'excuse Julien. La possibilité depuis le début est toujours là et puis on est toujours en train d'en penser, de faire les plans. Qu'est-ce qu'on peut faire pour retirer si on a besoin. Et comment on peut balancer ça avec l'importance qu'on continue d'avoir une économie ici, mais on est en train de toujours y penser et j'espère qu'on ne doit pas le faire, mais on va, dans les prochains jours, en discuter, j'imagine encore.
Si je peux me permettre, Dr Morrison, pour terminer, est-ce qu'aujourd'hui, c'est sécuritaire pour les insulaires d'aller à l'hôpital Queen Elizabeth? Est-ce que vous déconseillez aux insulaires d'aller à l'hôpital?
Oui. Les insulaires doivent être rassurés qu'ils peuvent aller à l'hôpital La Reine Elizabeth. Et puis, je les encourage de mettre un non-medical mask pour aller s'ils peuvent. Et puis, je sais qu'ils vont être... toutes les choses sont en place là-bas pour en prendre soin d'eux. Et puis, ils doivent se sentir bien en sécurité d'aller à l'hôpital.
Merci beaucoup.
OK, merci.
Alton Jenkins, The Guardian.
Hello, yes, I do have one more question. It's about seniors who are feeling trapped inside their senior home or wherever their accommodations are. Just wondering what are some of the safe activities they can engage in, especially with the new cases, perhaps, making, family members shy to take them out or whatever. What are seniors allowed to do who are in care and feeling maybe a little bit trapped? How can they feel a little bit less trapped?
Also, are you speaking about seniors who may be in care facilities or?
Yes. Yeah.
Well, I mean, certainly that over the last few months, seniors in long-term care facilities right across the province, public and private, it has been really a challenge for them, and I know we've really been pleased that we've been able to make some steps towards increased visitation in long-term care over the last number of weeks. So I think that's been important. I think the staff at the facilities have been very good and innovative in trying to help residents communicate with families in a different way. I think having homes now even do more activities like organize certain drives, for instance, that the home itself may take residents out for a recreational activity. Those are things that are being worked on and being looked at and continuously looked at. Again, balancing, we just finished, concern related to a long-term care facility last week. So we realize how quickly it can be impacted, and they are as a group, very vulnerable. We know that a large percentage of the deaths related to COVID-19 in this country were associated with long-term care or seniors facilities. So hopefully that addresses a little bit of your question.
Yeah, and I think I wanted a bit of a reminder about, I remember you had mentioned it was okay for seniors to go for drives with family members. Can you remind us about that?
So those were in community care facilities, and I think it's that in community care facilities where family members may be able to take the residents out for a drive. That guidance is available, I believe, on the website, and so it's good that you've been able to ask the question so we can clarify that. Again, just like a lot of the other things we've done stepwise and a cautious approach. So that's one other area in terms of visitation and activities, both in community care and in long-term care. And sometimes it's hard to make the distinction between those two types of facilities.
Thank you.
Thanks. Dr. Morrison, I just want to follow up. As I understand from one of your responses to Brian, it sounds like many of the healthcare workers who were to be tested because of this case have been tested, that were negative, and they're working in the ER again. I just wonder, because I know we have heard that, there can be instances where people are carriers, but, in the early days they test negative. It seems like you're even entertaining that as a possibility with this healthcare worker who traveled outside the bubble. I just wondered if you have anything to say to people who might therefore be concerned about their safety if they need to go to the ER where these people are working.
So, Carrie, I mean, and certainly we can understand that concern and anticipated that kind of question. And some of the healthcare workers actually will end up being tested twice, depending on the exposure to the case. And so I think that will increase that sensitivity of the testing. I think the enhanced personal protective equipment is really important, and that's what is underway at the hospital. I think we've talked about it. This is really hard for frontline healthcare providers. Our triage, our nurses, our auxiliary staff, everyone in the system, our diagnostic imaging, our EMS, and so they are taking increased precautions, and they are being tested, and it is a place that if you need to go to be looked after, you should feel safe going, and it's important that we know that it is a good place to go to get, and it's a safe place to go, and that we are doing extensive testing of patients and other staff as we've done before, as we did last week, to make sure that we're not missing anybody.
And so you mentioned some staff will be tested a second time. Was there any consideration as to, or was it even a possibility that some of those people might remain in isolation until they get a second negative test?
It's time-wise, right?
Yeah, and so the second test is related to the time. So for instance, the staff that were all tested yesterday who had contact with the initial case, it was more than 7 days since the exposures, so that's why we're very comfortable with that one negative test. And there may be, depending on the case, there may be some staff who will self-isolate until the second test comes back, but that is not the standard at this point in time. It's to make sure they're tested, make sure they're wearing appropriate, and in this case, enhanced personal protective equipment. We need our essential healthcare workers to be there for us, and make sure they're safe so that they can keep Islanders safe.
Thank you.
You're welcome.
And Carrie Lynn McLeod. I think that's it for questions today. Thank you.
I have another question. It's Brian Higgins.
Go ahead.
Dr. Morrison, that WestJet flight, July 2nd, you mentioned, was the healthcare worker on that flight returning to the island? Is that why you mentioned that flight?
Yes. Yes, the healthcare worker was on that WestJet flight 654 on July the 2nd. That flew from Toronto to Charlottetown. And we have reached out to the airline as well through our normal channels to also let them know. So if you do not need to get tested if you were just on the flight, but if you have any symptoms, please call 811 or your family doctor arrange for testing at the testing clinic if you were on that flight and experiencing symptoms.
Thank you.
Thank you very much, everybody. Appreciate it.